Hello and welcome. I am Dr. Ankit Parakh. I work as a consultant in pediatric pulmonology, allergy, and sleep medicine at Children's Chest Clinic, New Delhi. In this video, we'll be talking about pollen allergy in children. Now, what are pollens? So, pollens are very small particles which are released from various plants, and these help to fertilize the same species of the plants. Because they are very small in size, they cannot be seen with the naked eye. A lot of plants like grasses, weeds and trees release pollens, and there are specific months during which these pollens are released from these plants. Now, many of these pollens can lead to allergy reactions in children and adults. Most flowering plants do not lead to these allergy reactions. So let us understand what is pollen allergy. So pollen allergy is usually an allergy reaction to the protein which is contained in the pollen. So the body recognizes this pollen as a foreign object, and our immune system tries to fight against this, and that leads to allergic problems. Now, what are the symptoms of pollen allergy? So, pollen allergy usually leads to allergy in the nose, which is called as hay fever or allergic rhinitis. It leads to allergy in the eye, which is called as allergic conjunctivitis or spring cattrah, and it can also lead to allergic chest or asthma. Now, children or adults with nasal allergy will have a lot of sneezing, watering nose, blocked nose, and a lot of itching in the nose. Now, children or adults with eye allergy will have watery eyes, they can have itchy eyes, and they can have red eyes. Children with asthma can have cough, they can have breathing difficulty, they can have exercise intolerance or coughing or dyspnea on exercise. Now these problems in pollen allergy are usually seasonal during the pollen season. And as I said, the pollen season is variable for different weeds, grasses or trees. Now what are the usual pollens which we find which leads to allergy reactions in children and adults? So usually these are pollens of grasses, weeds or trees. The flowering plants usually do not lead to pollen allergy. The usual grasses which leads to pollen allergy in India, these are things like Bermuda grass, Johnson grass. They could be things like jowar, bajra, etc. Weeds which lead to pollen allergy are things like mugwort, they can be ragweed, they can be things like amaranthus, or they can be pigweed. And there are certain trees like Hulupteria or mesquite which can lead to pollen allergy. Now, they can be different in different parts of India depending on the region in which you live in. People who live in coastal areas, even coconut plant can lead to pollen allergy. People who live in the Himalayan range, they can have allergy to birch, they can have allergy to alder and hay as well. Now, how do we diagnose a pollen allergy? Now, pollen allergy can be diagnosed in two ways. That is by doing an allergy test. Allergy test is done by usually a skin prick test, where we put small amount of allergen drops of the various pollens on the forearm of the child, and we scratch it with a specific lancet, and that leads to an allergy reaction to which the child is allergic. This reaction is visible in the next 10 to 15 minutes, and the results are recorded. The other way of diagnosing pollen allergy is by doing an allergy blood test, which is also called as cattrah. Both the tests are very sensitive and specific and can be easily done. Skin prick test is although the preferred modality for diagnosis of pollen allergy. Now, if someone is found to have pollen allergy, then what do we do about it? So there are two things which we need to do. One is prevention and the other is treatment. Now, in prevention, the most important thing is that you should know that during which season you or your child are having pollen allergy. And if we know to what pollen you are allergic, then it becomes easy. Now, during the pollen season, we usually advise children to restrict outdoor activities to reduce the sensitization to pollen. Doors should be closed, the windows should be closed, and even we advise that whenever you are traveling in your car, you should try and avoid. So we would also advise that you keep the window panes up while you are driving or traveling in your car. It is also advisable to use sunglasses to reduce the amount of pollen going into the eyes. And we also advise that after you go back home, you take a shower and change your clothes so that the pollens which are stuck to your hairs or clothes do not enter the nose or the eyes. Now, how do we treat a pollen allergy? So, if a child or adult has a pollen allergy, usually we require intranasal sprays and antihistamines for the nasal problems. These are quite effective. For the eye, we have some eye drops like antihistamine drops, mast cell stabilizers, and we have lubricant eye drops which are very helpful. Children with asthma require inhalers with inhaled corticosteroids and bronchodilators for the pollen allergy duration. Now, if a child has pollen allergy every year, then we can start symptomatic treatment before the pollen season starts. We cover up the pollen seasons with the medicine and we can stop the medicine once the season goes. Some children who have uncontrolled pollen allergy despite these medicines can also benefit from immunotherapy, which is highly effective. So for more information on pollen allergy, you can log on to our website, Ankit Parakh.